Let me ask you something personal. Does your morning coffee smell slightly less intense than it used to? Has a favorite meal started tasting bland for no clear reason? Have you or someone you love suddenly developed a craving for sweet food that never existed before? Most people brush these off as aging or stress. But the science says something far more alarming. According to multiple large-scale clinical studies, dementia does not begin on the day of diagnosis. It begins silently in the brain 5 to 10 years earlier, and the very first signals it sends are changes in smell and taste. Approximately 55 million people worldwide are currently living with dementia, and around 10 million new cases are diagnosed every year. Between 60 and 80% of those cases are Alzheimer's disease. What makes Alzheimer's uniquely dangerous is that, by the time memory problems become obvious, the brain has already suffered years of quiet damage. Tissue level changes and toxic protein accumulation begin long before a single symptom is noticed, which is exactly why early detection matters so enormously. To understand why smell goes first, you need a brief map of the brain. When you inhale a scent, the signal travels from the nose through the olfactory bulb into the entorhinal cortex, a brain region that connects directly to the hippocampus, the center of memory formation. This pathway is precisely where the toxic proteins of Alzheimer's disease, tau and beta amyloid, accumulate first. Because the olfactory circuit and the memory circuit share this neurological real estate, damage to one begins, affecting the other before any cognitive symptom appears. A landmark study published in a leading neuroscience journal found that olfactory dysfunction was present in approximately 85% of early-stage Alzheimer's patients, with the deficit appearing before measurable memory decline. A separate large-scale prospective study followed over 1,000 older adults using standardized smell identification testing, and found that those who scored poorly were more than twice as likely to develop dementia within 5 years. Even more striking, research from a prominent university medical center found that for every 10% drop in olfactory function, dementia risk increased by approximately 19%. The clinical tool known as the smell identification test, which presents 40 scratch and sniff odors for identification, showed in a major multi-center study that scores at or below 34 out of 40 predicted conversion from normal cognition to Alzheimer's dementia within 5 years, with 90% sensitivity. This is not folklore. It is reproducible, peer-reviewed science accumulated over decades. Taste changes tell a similar story, and they are just as overlooked. Research published in an international clinical journal found that Alzheimer's patients showed significantly elevated detection thresholds for sweet and salty tastes, meaning they needed far stronger concentrations to perceive the same flavor. Food begins to taste like nothing. Meals that were once enjoyed become uninteresting. At the same time, studies report that between 5 and 39% of Alzheimer's patients develop a strong new preference for sweet foods, often driving them to consume sugar, desserts, and processed snacks in unusual quantities. In a specific subtype known as frontotemporal dementia, an intense craving for sweet foods and compulsive overeating is frequently the very first symptom that family members notice, often months before any obvious memory problem, and it is commonly mistaken for a personality change or depression. There are 5 daily warning signs to watch for. The first is difficulty identifying familiar scents, such as being unable to distinguish coffee from tea by smell alone, or no longer recognizing the aroma of a perfume you have worn for years. The second is food suddenly tasting flat, bland, or uninteresting in a way that persists beyond a cold or seasonal allergy. The third is a new and unexpected craving for very sweet or intensely flavored foods, particularly if this represents a clear departure from lifelong habits. The fourth is failing to detect warning smells such as gas leaks, burning food, or smoke, which moves this issue from inconvenient to genuinely dangerous. The fifth is phantom smells, meaning perceiving odors that are not present, which can occur when the olfactory processing pathways in the brain are disrupted. An important distinction is needed here. Not every episode of reduced smell indicates dementia. Colds, nasal polyps, sinus surgery, smoking, medication, side effects, and lingering effects after certain viral infections can all reduce smell sensitivity. The pattern associated with neurodegeneration is different. It is persistent, it does not recover on its own, and it affects the ability to identify and distinguish smells, rather than simply reducing overall intensity. If you are concerned, please see a qualified healthcare professional for proper evaluation. Now for the most practical section of this video. Research published in peer-reviewed journals has established that olfactory training, the deliberate and repeated exposure to distinct odors, can improve olfactory function in older adults, and appears to produce measurable benefits for broader cognitive function as well. A randomized controlled trial found that olfactory training, targeting cognitive processes such as memory, produced significantly better outcomes than odor exposure alone. A 5-month clinical study in which participants trained twice daily showed meaningful improvement in cognitive scores compared to a control group. Here are 3 practical protocols you can begin today. The first is the standard 4-scent training routine used in clinical research. Prepare 4 essential oils: rose, eucalyptus, clove, and lemon. Apply a small amount to a cotton swab or place a few drops in a small jar. Twice daily, once in the morning after waking and once before bed, slowly and deeply inhale each scent for 10 to 20 seconds. While inhaling, actively call up a vivid memory or image connected to that scent. The combination of sensory input and memory retrieval simultaneously activates the olfactory pathway and the hippocampal memory circuit. The entire session takes 2 to 3 minutes. Consistency over months is what produces results. The second protocol focuses on nutrition that directly supports olfactory and cognitive function. Zinc is essential for the normal operation of olfactory receptors, and deficiency is a documented cause of smell loss. Include zinc-rich foods such as oysters, beef, pumpkin seeds, and tofu at least 3 times per week. Omega-3 fatty acids maintain the fluidity of neuron cell membranes and reduce neuroinflammation. Aim to include oily fish such as mackerel or sardines, walnuts, or flaxseed oil in at least 1 meal daily. Vitamin B12 protects the myelin sheath around nerve fibers, and deficiency can impair both smell and cognition. Eggs, dairy, and lean meat are reliable sources. The third protocol is a daily self-monitoring practice. Choose 5 familiar household items with distinct scents, such as ground coffee, vinegar, cinnamon, a citrus peel, and a herb like basil. With eyes closed, smell each one and try to identify it by name. Do this once a week and note whether your accuracy changes over time. This is not a medical test, but it creates a personal baseline and increases your sensitivity to gradual changes that might otherwise go unnoticed. Your 7-day action plan is as follows. On day 1, perform the 5-scent self-check and record your results. On day 2, acquire your 4 essential oils or identify kitchen equivalents. From day 3 onward, practice 2-minute olfactory training sessions, morning and evening. On day 4, plan 3 zinc-rich meals for the coming week. On day 5, add an omega-3 source to every dinner. On day 6, introduce the memory linking visualization during your scent training session. On day 7, compare your self-check results to day 1 and commit to continuing for a minimum of 3 months, which is the timeframe most studies use to observe measurable change. One final and essential reminder: everything in this video is health information and does not replace medical diagnosis or treatment. Dementia is a complex condition that requires professional clinical evaluation. If 2 or more of the warning signs described today are present in you or someone you love, please do not delay. A neurologist or specialist dementia clinic can perform validated testing and provide a proper assessment. Early intervention is not just helpful. In dementia, it is the most powerful tool we currently have. Your brain sends warnings years before the crisis. Today, you learned to listen.